Welcome back to Long Covid Doctor, an educational series for sufferers of long Covid. This is the second part on brain fog and long Covid. In part one, I talked about the symptoms, the diagnoses, the investigations, and the many causes for brain fog. Here we are, part two. I'll talk about the treatments, management, and outcomes. The references, links, and resources are in the show notes below. Any advice, diagnoses, treatments that I mention should only be considered after discussion with your own GP or qualified health professional. So here we go. Part two on brain fog and long Covid. The management of brain fog with long Covid. Firstly, what has happened so far? The patient, you have been to your doctor with the problem, your long Covid problem, the brain fog. And what has your doctor done? He's assessed your symptoms, history, examination, and investigations, blood tests, and if any of the differential diagnoses, other causes have been discovered, they will have been addressed, of course. Maybe it's resulted in a referral to the hospital, a specialist, a neurologist, for example. Maybe an MRI scan of the brain is indicated. That'll be the decision of the specialist. Then secondly, it's important that other long Covid symptoms are treated, other symptoms that you may have coincidentally alongside your brain fog. So, with the history examination, it may be discovered that, you may have been also having mast cell activation. So, that's important to treat. So, H1, H2 blockers, antihistamines, antiacid tablets, they're sort of off-label, off-license. So your GP may feel comfortable with this and prescribe it, or maybe not. I mean, I've heard, patients with mast cell activation actually incidentally have said, as a sort of afterthought, said, with their treatment of their mast cell activation, that's improved those symptoms. But a number of patients have come back and said to me, look, my brain fog is a bit better and my fatigue is a bit better. So it's probably worth a trial of those two treatments, the H1 and H2 blockers, maybe for a couple of months and see whether it improves things. It's not unreasonable. Other symptoms that patients experience with their long Covid would be, say, the headaches or migraines. Those patients need to have those symptoms addressed. With amitriptyline, for example, a excellent drug it's a neuropathic drug. It's an old-fashioned antidepressant. We're not prescribing it for that. We're prescribing it for its effects on nerve fibers. It's used to prevent migraine, for example. And so, if you have got this headache and migraine alongside your long Covid brain fatigue, brain fog, I think it's important to have those problems addressed and treated appropriately as well. Likewise, other symptoms, such as the Covid grip, the chest pain that patients describe because their lungs feel like they're on fire and a sort of inflammation of the lining of the lungs. So a trial of colchicine would be helpful for that. Patients who are also experiencing palpitations, rapid heart rate for no reason, or fainting or near fainting type sensations, lightheadedness, they may well have POTS, postural orthostatic tachycardia syndrome. So, treatment with a beta blocker or referral to a cardiologist may be appropriate and effective and help them on those symptoms alongside their other long COVID sort of brain fog symptoms. So it's important to just keep those other problems in mind and deal with them appropriately. So now on to the long COVID brain fog more specifically. So what can we do to help recovery from long COVID brain fog? Before we go into specifics, I think it needs to be said, for a patient with long COVID, having got to this point, they've probably had an opportunity to share their problem with their doctor or the long COVID clinic that they're being managed by, a health professional who's dealing with other patients with long COVID. I think this is important just to acknowledge, because this actually is really helpful for the patient, for validation of their problem, their long COVID problem, that it's real. It's not all in the head. It's not imagined. I think it also brings reassurance to be listened to, reassurance that, that patients will therefore be supported. And also, certainly in our clinics and our experiences, that, that long COVID on the whole improves with time. And certainly brain fog improves with time. I've heard patients say this. This is what we're seeing in our clinics. All these things are really important for the patient to be aware of and to hear. And so now on to the actual management of long COVID brain fog. I think the key point to all long COVID is there's no one magic bullet, like I sort of described in the first part. There are so many causes for long COVID. No one treatment is going to address all those causes. There's no one magic cure, one magic bullet. Treatment is not just one thing. Treatment is all to do with a package, if you like. One of the most important elements of that package, of course, that applies to everyone and everything to do with long COVID, is to do with energy building and energy controlling. Basically, the key to this is using our age-old friend, the 3 Ps: pacing, planning, and prioritizing. So pacing, what do we mean by this? The process of balancing activity, that be sort of physical, mental, or emotional, with rest. Pacing gives us an awareness of our limitations. By knowing your limitations, you can plan how much energy you use, and sort of most effectively and most efficiently. So that's pacing. The second P is planning, structuring your day. A fixed get-up time in the morning. Get an alarm clock. A fixed bedtime. Be strict with yourself. Build in rest times into the day, in the morning and the afternoon. Be strict. No more push on through. Give yourself time out. Time out. It's very important. Also with planning, break tasks down into smaller chunks, bite-sized chunks. Be strict. Self-discipline. Be bossy with yourself. Resist temptation to complete a task. It's okay to stop halfway. If you're vacuuming the house, don't vacuum the whole house. If you want to vacuum the whole house, don't vacuum the whole house. Only vacuum half the house. You get my point. And then third P, prioritize. Well, you've got to prioritize what needs to be done and what can wait. What you can forget about altogether. Then prioritize the order in which you do things. Do the important things first. The less important things, put to one side. You do those second. Or get someone else, better still, get someone else to do them. If you can, delegate. Or better still, discard them. Things that don't need to be done, just bin them. So, now let's move on into the more specifics regarding brain fog, long COVID brain fog. The two main difficulties that patients with brain fog have are to do with concentration and memory. Concentration and memory. Let's think about them in turn. So first of all, concentration. three types of concentration, really. Concentration, patients find it difficult to concentrate with for an extended period of time. Okay. Or there's difficulties with concentrating when there's background distractions. Or there's difficulties with concentrating on more than one thing at a time. So concentration difficulties. And then memory. So there are difficulties with taking it all in due to poor concentration, due to distractions or stress or pain or poor sleep. You can't take it all in. Then there's difficulties with keeping it in, retaining it. Perhaps it's due to direct insult onto the brain because, the memory area, the hippocampus, has been affected. Maybe that's the reason. Can't retain it. Or difficulties with retrieving it. So it's gone in, it's in your memory, but you can't remember it as it goes as soon as it's gone in. Maybe it's because of poor concentration. Maybe because of the brain insult. Or maybe it didn't go in the start anyway. So these are the things that our patients are telling us, but essentially it all comes down to these two elements, and that is the concentration and the memory. Okay. And so, what are we going to do to tackle these problems? Okay. There are a number of strategies, handy tips that can help. So, let's tackle each in turn. So, first of all, concentration. That's what I started with. Concentration. What are the handy little tips to tackle a task? Okay. You've got to think the task through before the off. Okay. That helps. Break the task down to small chunks. Divide the task into chunks and goals. Okay. And then take breaks. Stop after 15, 20 minutes. Have a stretch. Blast of fresh air. Don't push on through. Take breaks. Okay. Remember, one thing at a time. No more multitasking. Think of the best time of the day that you can do these things. So the morning or the afternoon or after a nap. Certainly not straight after lunch or at the end of the day. Okay. So think of those, ways to tackle the task. Then tips for doing a task. Okay. You've tackled a task. Now we're on to doing the task. Basically, we want to rule out distractions. Background chatter, the TV on, the radio on. Use earplugs, okay, to block out the background chatter, TV. You don't want interruptions, do you? Okay, turn your phone off, leave it to voicemail, or put an out of office message on your emails. You don't want to be interrupted. And then tips for focus, how to keep focused, okay, while you're performing the task, okay. Well, while you're performing the task, whisper to yourself or talk out loud during the task. That's to keep you on track, okay. Now I'm doing this, okay. Whisper, talk to yourself through the task to keep yourself, as I say, on track. Or focus, say you're reading text. Well, why don't you could use a ruler, put a ruler under the line you're reading, and then slowly, when you complete the line, move the ruler down. And then it stops your eye jumping around, flitting about. It keeps you on that line. Or a little trick other people have is use a marker pen or a sort of a pencil, underline what you're reading at the time. So these are all sort of handy little tips to keep focus whilst you're doing a task. Another common problem with long COVID brain fog is word finding. Remember I say that's one of the presenting symptoms of, you get halfway through a sentence and you lose your words. and you can't think of the word. You have sort of, if you like, recall or memory block for a particular word. It's on the tip of the tongue, but you can't get it. So don't try and sort of scrabble around in your brain looking for that word. Talk around that missing word. Get to the end of the sentence, but avoid that word that you can't find by sort of talking around it. Describe it in a different way. Describe what you're trying to say in a different way. Ask what you're trying to say in a different way. Then what about tips for finding things? Because again, a lot of patients do say, oh, I keep on losing things. I don't know where I put it. I put it down. I can't remember where I put it down. Well, mental retracing. Stop. Sit down. Think to yourself, what was I doing when I last had my car keys, for example? And then trace back what you were doing. Retrace your tracks. And then, probably more often than not, you'll get to where you left your car keys. It's usually probably somewhere very strange. Remember what I said, that patient who left the car keys in the fridge. Could be strange. Could be somewhere usual, but retrace your tracks. So those are the handy tips for helping concentration. What about some handy tips to help with memory? Okay. How are we going to try and remember things? Well, basically, say it over in your head. Say it over, maybe even out loud, over and over again. Just reinforce it. Same with someone's name. I mean, I think this is pretty common. It's not just long COVID. When you are introduced to someone in a party or the pub or something, before you know it's out of your brain. So say the name in your head out loud again, and that reinforcement, hopefully it will lodge in your brain. Whilst we're on the topic of can't remember someone's name, well, look, if you can't remember someone's name, just tell them, look, sorry, I can't remember your name. What did you say your name was? Apologise. Or look, I've got long COVID and it's affecting my memory a bit. Okay, you're just going to have to tell me your name again. I do apologise. Well, there's no harm in that, is there? Telling them that you've got this long COVID brain fog and apologise. They will understand and tell you their name again. Great. And then repeat it a few times yourself. And then other little tips and tricks for helping memory. Lists. Well, again, I couldn't survive without lists. I don't have long COVID brain fog, but I couldn't survive without lists. If I had long COVID brain fog, I would need my lists. Keep a notebook, and then when you do, complete a task on that list, tick it off. Makes you feel good. But it's a reminder that it's been done. Calendar, get a calendar, old-fashioned calendar. Put it on the wall in the kitchen. Or, a lot of us use calendars on our mobile phones now. Very handy. Things don't get missed like they could do. Post-it notes, another way of prompting you, reminding you. Post-it notes. Again, I used to do in general practice, going to patients' homes, there were post-its on the fridge, post-it, on the sort of the notice board, post-its, on the back door. Don't forget your keys. There's no harm in using post-its. Very good way of reminding you. What else? There are other little tips you could use, and that is ways of stopping losing things. I talked about the car keys. Well, why don't you have a hook near the back door, or on a piece of furniture, or against the wall, on the wall, where you hang your keys, or a phone bowl. A lot of people have a phone bowl, don't they, or a key bowl near the back door on a piece of furniture. Always put your wallet or your purse in your handbag or the top drawer when you've come in. Make sure you always do it as a matter of course. Other little prompters, a cooker, a timer, so most people in their kitchen, they have a timer for their eggs, whatever, boiling the eggs. Well, that's very good for reminding you when you should be in some place at some time. Again, a lot of people use their timers on their mobile phones to remind them they've got to do such and such and be such and such at such and such a time. Pill dispensers, really, really helpful. Again, so many patients use pill dispensers, and they keep them, by the kettle, in the kitchen or next to the sink. It's always there. You're always going to the sink. You're always going to the kettle. Pill dispenser there. Have I had my pills? Yes. Can I check? Yes. Done. I think the other thing is, again, from what I was saying about, if you can't remember someone's name, and say to the patient, look, I can't remember your name. Well, there's no harm in saying that, when people are explaining things to you, for example, just tell them, look, just go slowly. But got a bit of brain fog, or ask for help if you don't quite get it, can't quite work it out because your executive function's not as good as it used to be. Ask for help. There's no harm in that. A lot of my patients, whilst I was in general practice, were so proud in telling me that they've been visiting the brain gym, and what they mean by that is they've been doing brain training exercises, Sudoku, or the Times crossword, or Scrabble, or not poker. I was going to say bridge, maybe poker. These are good because they're on the whole social activities, which is not a bad thing. In fact, it's a very good thing. But more often than not, these, in a way, it's not going to help globally. It'll mean you're pretty good at Sudoku, but not necessarily good at remembering where your keys are. So it can help, and it has other fringe benefits. But I think we've just got to take the general approach to address the whole picture. And like I said, I think it's really important. At the start, I said, it's important to address fatigue, the commonest symptom of long COVID. Remember what I was saying about the 3 Ps. It's important to address sleep and worry and mood. More on that a bit later. So, in a way, that sort of does lead into the next section, and that is the general management of long COVID and a general management of long COVID brain fog. What else can we do to help recovery from long COVID? I think it's important, to mention it's important to take the general view, the holistic view. We need to think about, all those other things that are important to us as human beings. And that is nutrition, diet, sleep, and sort of mind-body balance. Diet, mixed balanced diet, Mediterranean diet, so important because it will contain all the minerals, vitamins, and antioxidant polyphenols that you need for building blocks for cellular repair and anti-inflammatory properties. The Mediterranean diet also contains a ton of prebiotic fiber for our microbiota. So it nourishes our friendly bacteria. And like I said earlier, the friendly bacteria are so important for our general well-being and our support of our immune system and production of hormones and neurotransmitters, chemicals, and vitamins. So important to have a healthy gut microbiota. I mean, whilst you're at it, remembering diet, remembering oily fish, omega-3, really good if you can't have 2 portions of oily fish, salmon and mackerel, sardines a week. There's no harm in having a capsule of omega-3 fish oils. I do. Why not? And I love fish, but actually, belt and braces, why not? And then finally, vitamin D. every talk has to have vitamin D getting in there. We live in the northern hemisphere after all. We're starved of UVB, especially in the winter months. Why not have vitamin D as a supplement? I do. Why not? That's nutrition. Sleep. Again, I talked about this a little bit earlier. Sleep, the great healer, refresh and repair. We've got to support our day-night cycle, circadian rhythm. Why? Because various hormones, particularly the growth hormone, the restorative hormone, is mostly secreted when we sleep at night. So remember, sleep hygiene, really important, strict bedtime. We've talked about structured days, etc., etc. But, it's important for this reason as well, to support our day-night rhythm. No mobiles and, your iPads and tablets, blue light emitting screens an hour before going to bed. Maybe some magnesium, maybe some melatonin. Both of those have been proved to be effective for sleep, quality sleep. And then I talked about mind-body. What is that all about? Well, respecting the mind and the body and recognizing the interactions between the mind and the body. So mindfulness. We've all heard about mindfulness now. You could download the Headspace or Calm app, not too expensive. Download it to your mobile phone, and that's a sort of a nice tool to use for mindfulness. And this is backed up by loads of studies that demonstrate it's very good for stress reduction and blood pressure reducing, and MRI scans show that people who do mindfulness regularly, even after say 20 minutes a day for 6 weeks, show changes, improvements in the departments in the brain that deal with memory, the hippocampus. So it's not just because it makes you feel great, it's also because there's supportive evidence that it brings about active vegetative change in the brain. If you practice mindfulness regularly, I thoroughly recommend it. And then in the same sort of bracket is yoga and Tai Chi. Again, mind body. It's good for stress reduction, high blood pressure lowering. Incorporates focus and breath control and coordination. Try it. Why not? Nothing to lose. So those are the sort of, if you like, as I've said, general sort of strategies to help recover from long COVID and hence long COVID brain fog. Other resources which are helpful, I've put sort of in the show notes below, resources that are good for your long COVID recovery. The NHS website, your COVID recovery, it's called, which is a sort of self-help patient resource for symptoms and information self-management. There's also another excellent resource for fatigue in long COVID on the Royal College of Occupational Therapists website. That's excellent. So there we are. Those are the sort of the treatments and management strategies that I'd suggest for recovering from long COVID in general, but long COVID brain fog. And so finally, the recovery, the time course and the outcomes. Well, hopefully all that I've said, with all I've said and the advice and guidance I've given you, your long COVID will start to improve and you'll notice a difference and hopefully resolve. At this point, a lot of our patients are asked the question sort of, how long will it take though? How long will it take for me to get better? And what does the recovery look like for me? What's the final outcome? So, question, how long will it take? The answer, well, I'm afraid it's impossible to predict. It is unpredictable. We don't have a crystal ball. When I first started in long COVID, we were saying, because this is what we thought, it's going to take 9-12 months and then it'll all be all over and you'll be back to normal. But I'm sorry, that's not the case, which is harsh. 3 years on, there are still patients who are suffering. So how long is it going to take? We don't know. The other question, the extent of the recovery, what's the outcome? Well, hopefully, and we've seen this, hopefully the majority of the patients will make a full recovery, get back to normal life. But there is inevitably going to be a proportion of those patients a small percentage, whose recovery won't be full. It'll be partial, or maybe they'll have a sort of relapsing, remitting time course. They're fine, they recover, and then their system gets knocked by another virus or stress or something like that, and then they have a bit of a crash. Unpredictable, but it may be that's how it is in the long term. So like I said, unpredictable. Everyone's different. But basically, improvement from your long COVID brain fog will occur alongside the natural recovery from your long COVID. And for this to happen, there has to be sort of rebalancing of all the body systems, the inflammatory system, the immune system, the glandular system, the endocrine system, the nerve systems, the neurological systems, alongside the natural tissue and cellular repair. There's nerve fiber repair that will occur with regrowth and reconnection of nerves through the process of what we know now is called neuroplasticity. Those areas that have been damaged, the hippocampus, the memory area, or the prefrontal cortex, the executive function areas, they will be rewired, if you like. New nerves will grow, rewire, reconnect. And so those pathways will, if you like, come back into life. And then the microclot story, well, clots clear eventually anyway through natural clearance processes. It takes a long time. So the process of what we call recanalization happens naturally. But there's also neovascularization, that is, new blood vessels sort of are created around blockages. So sooner or later, those blood clots will either disappear or they'll be bypassed. And so the area that's served by that blood clot, that blood vessel that's being blocked off, will be restored, and hence, therefore function again. But, we need time for these natural processes to work. And along with that, we need, if you like, acceptance. I mentioned this earlier, to accept that this has happened, that you've got long COVID, to accept that, the time frame is uncertain, to accept that the outcome is uncertain. We need to accept it, not to fight it, to give in to it, if you like, and above all, to give it time. So, there we are. That concludes the second part of my talk on long COVID brain fog, following on from my first part earlier. I hope you found that helpful. As I mentioned at the start, any advice, this is the disclaimer, apologise for that, but, any advice, diagnoses, treatments that I mention should only be considered after discussion with your own GP or qualified health professional. So, in the meantime, I wish you well. I wish you well with your recovery from long COVID. Thank you.